Hi everyone, Dr. Brown here again with October's Clinic Minute covering women's health. Most of us know that October is Breast Cancer Awareness Month. The United States Preventative Services Task Force recommends women aged 40 to 74 get a mammogram every 2 years. Many doctors, myself included, recommend women get yearly mammograms, and those with dense breast also get a breast ultrasound. I encourage women to do mammograms for as long as they want, since cancer risk increases with age and many women have long life expectancies. If you feel a lump or a bump in your breast at any age, or even after a recent mammogram, you must get back to your healthcare provider for re-evaluation. This goes for men too. And what other screening test may you need or want? The colonoscopy recommendations are currently to get screened at age 45 years of age if at normal risk. There are other ways of screening for colon cancer if you cannot do a colonoscopy. Your doctor's office can educate you on those if needed. And you've heard me mention the importance of bone health. Most women start getting DEXA scans, the scans to determine bone health, at age 65. But if a person is at risk for osteoporosis, they should get them done much sooner. For instance, smokers or those with a family history should talk to their doctor. I like getting one done around the time of menopause. This also gives us a nice baseline earlier than 65 years of age. Most insurances cover these in postmenopausal women. Cervical cancer screening, or pap smears, are generally recommended every 3 years, but sometimes dual HPV screening tests are included and the interval is 5 years. It depends on your risk and your own personal pap smear history, but your doctor's office can help guide you on when your next pap smear is due. We do not start pap smears before the age of 21. Many times, early HPV infections can clear because of the young person's immune system. These days, everyone wants to get their hormones checked. Checking hormone values is inherently a bit difficult due to the fact that hormones fluctuate naturally and that values change as we age. But sometimes it is important to have the hormone discussion with your doctor. Many women suffer needlessly in peri and menopausal years. For example, dryness or dyspareunia can be horrible, but often easily reversed and managed with topical estrogens. Did you know that many women die due to complications of urinary tract infections as they get older? And topical estrogens are preventative of UTIs. They can help prevent UTIs if you have infections or postcoital infections often. Or many times our menses is irregular and heavy. These are reasons to talk to your doctor. Many people are embarrassed to divulge this kind of information to their physicians, but for us, this is routine. And women should know once they go an entire year without menses, they are by definition menopausal, and should they have any bleeding after that point, they need to go tell their doctor about it. And what about vaccinations? Men, you listen to this part too, or actually listen to the whole thing, because us women need your support so we can take the time and initiative to care for ourselves. Many women take on the caregiver role but fail to deliver the same services to themselves. Back to vaccination. Shingles vaccination is available at 50 years of age and is a 2-shot series. Pneumonia vaccination is available at age 65. Unless you smoke or have underlying health problems, then your provider will likely want you to have it sooner. RSV, respiratory syncytial virus, is available for the older patient or those at risk. A Tdap, tetanus, diphtheria, and pertussis booster is recommended every 10 years. Although if you are going to be taking care of a baby or have close contact with a baby, you want to have the shot within the last 5 years. Pertussis immunity can wane, and this vaccine is intended to prevent whooping cough, which is very dangerous to babies. It is also that time of year when you should consider getting a flu shot. Every year, influenza kills healthy, normal people, and the vaccine's risks are very low. So for me, it's a no-brainer to get the jab. This isn't a complete list of the available vaccines, and certainly if you wanted to see a complete list or think about traveling, then visit cdc.gov. Hopefully, I've got us thinking about better self-care and making our lists for our next doctor's appointments.